Great, thank you. So, welcome everyone to our SBHR seminar series on creative approaches to public health research. I'm Chloe Asker, a research fellow at the University of Exeter, and today I am really excited to introduce to you Dr. Rich Gorman, who is a senior research fellow in bioethics at the Brighton and Sussex Medical School. Rich is a qualitative researcher with a background in human geography, having done a PhD at Cardiff University in 2017, and he's interested in the social and ethical implications of different healthcare practices. Rich's research has explored a range of different contexts to reflect on how different forms of knowledge, expertise, and experience interact to enable quality care, ranging from the worlds of rare disease at Brighton and Sussex Medical School, systems of laboratory animal research at the University of Exeter, and nature-based therapies at Cardiff University. And today he's going to be presenting for us on researching the lived experience of rare disease through careful and creative methods. So now I'll turn over to Rich to share his screen and start the presentation. Thanks so much, Rich.
Great, thanks, Chloe. Share, let's see. Hopefully that has loaded for everyone. And you can see my slides are not mine, my
Yeah,
sort of notes. That's always handy.
all good. Thanks, Rich.
Great. Well, yeah, hello everyone. It's lovely to be here speaking to you today, and a huge thanks to Chloe for the invitation to be here. My name is Rich Gorman. As Chloe said, I'm a sort of social scientist and research fellow at Brighton and Sussex Medical School in the UK. And today I'm going to talk briefly about the research, engagement, and impact work that my wonderful colleague Professor Bobby Farcides and I have been doing as part of the Wellcome Trust funded Ethical Preparedness and Genomic Medicine project, where we've been working with families affected by rare disease and rare conditions to explore different ways of capturing and sharing important stories and messages about people's lives. As means to ensure that the current genomic enthusiasm in healthcare services is informed by a meaningful understanding of people's experiences in the medical arena and beyond. Before we get too carried away, though, I wanted to reflect on my own disciplinary background and consider what geography can add to discussions about creative approaches to public health research. Now, you might be wondering that too, being that for most people, geography is colouring pencils, maps, and everyone's least favourite pub quiz round. However, academic human geography as a discipline is much more than that. Geography is quite an eclectic mix. I'm always drawn to this beautiful description by Eden Kincaid, who says, when folks ask me what a human geographer is, I tell them that I'm 1/3 social scientist, 1/3 philosopher, and 1/3 artist. In a certain sense, intellectually at least, it seems like everything is possible in geography. This is particularly pertinent when we get into the subdiscipline of health geography. Health geography is about the differences in health and health-related experiences between places, the social, cultural, and political processes shaping the context for health, the health-related experience of healthcare provision, and the development of healthcare for places. Similarly, we have disability geography, which explores disabled people's experiences of space and place. Geographers have done much to challenge and develop understandings of disability, demonstrating how spatial, material, social, cultural, and political factors and environments shape experiences, considering stairs as much as stairs, a pun that works much better on the page than in presentation. What follows isn't going to be a geographic analysis, though it is shaped by geography's interest in creative methodologies and approaches to thinking about health and disability. So I suppose this is really just an appeal, a signposting, a prompt to think about geographical ideas and literatures too when you're thinking about creative approaches to public health research. Now that I've done my plug for geography, I thought I'd set the scene of the larger project that this package of work is part of, the Wellcome Trust funded Ethical Preparedness and Genomic Medicine project, which is a large mixed method study run from Brighton and Sussex Medical School and our colleagues at the University of Oxford. As a whole, the project really examines how the promise and challenge of genomic medicine is understood and experienced by those providing and engaging with the service, and aims to produce a rich and nuanced account of the ethical issues relating to genetic and genomic interventions within the NHS. We describe ethical preparedness as a state for identifying and articulating ethical issues in a timely and ongoing manner, with the tools and skills to address them. Rather than focusing on compliance, an ethically prepared approach encourages professionals, healthcare professionals in particular, to develop skills to consider ethical issues with confidence and calls on organizations to prioritize the time and space for quality ethical discussion and deliberation within day-to-day practice. As part of this project at Brighton, our work has really had a specific focus on understanding things from the perspective of those engaging with genomic medicine services, patients and their families, with a specific aim to help healthcare professionals better understand the perspectives of families affected by rare genetic conditions. Rare diseases are sometimes known as orphan diseases. They're medical conditions that affect a limited number of individuals. In the UK, this is defined as a condition which affects 1 in 2,000 people or fewer. Depending on classification systems, there are between 6,000 and 8,000 rare diseases, and that number is rising, obviously, as diagnostic science advances, which has sort of resulted in the rallying cry of the rare disease movement that whilst each disease itself may be rare, it's not rare to have a rare disease. And thus, as a signifier, rare disease is a category which increasingly sees social and community activism and identity coalescence. Most rare diseases are genetic, chronic, and often severely disabling, with impacts across medical and social domains. Whilst individual conditions will bring unique challenges, there are also commonalities across rare diseases, such as often lengthy diagnostic journeys, low social and scientific awareness, a lack of community, and scarce resources. Understandably, a medical frame dominates most discussions of rare disease, but there's a growing recognition that rare disease requires sensitive understanding of the influence of social and cultural factors on the experiences of affected families. So thinking about whether accounts of patient experience might contribute to the preparedness of clinicians to deal with the ethical challenges of genomics practice has prompted us to think imaginatively and critically about just how accounts of patient experience can be collected, collated, curated, and disseminated. Methodological creativity and plurality is increasingly recognized as enabling more nuanced perspectives, creating different modalities of knowledge and creating more participatory approaches. Research in the social sciences, and particularly in geography, I must say, is increasingly challenged to evoke, not just explain, and experiment with finding new ways to use the narratives collected in research. And these theoretical and methodological trends, along with support and encouragement from our participants who have directly informed and guided our research, have led us to engage with arts-based research methods, with the hope that such might express and evoke aspects of lived experience in productive and affective ways, beyond what we felt was possible through more conventional social scientific registers. Now, I realise that given the context of this seminar series on creative approaches to public health research, I'm likely speaking to people well aware of this area and movement within research. But for those who may not have come across arts-based research methods before, which I must admit was largely me before the start of this project, it's been a real learning curve for me, an opportunity. There's a growing body of evidence that showcases the value that the creative arts can bring to healthcare. Artistic approaches have been mobilized as part of health promotion, empowerment, and behavior change campaigns, and they're increasingly recognized as playing an important role in the training of healthcare professionals. The arts are also becoming a valuable method within health research itself, particularly as an innovative means of both knowledge production and knowledge dissemination. Arts-based approaches can enhance health research by illuminating and elucidating human dimensions of health and illness in ways that can augment our understanding of health and social care. We know that stories are integral to medical care. Story forms the basis of medical care in the narrative and the narratives that patients bring to their doctors, and in the narrative that doctors construct in relation to their patients. As Catherine Hunter argues, in its representation of subjective experience, narrative gives us access to the perceptions and valuations of other human beings. And thus a narrative bioethics is a means of thinking about the meaning of illness in the life of a patient and about the role of the physician in the patient-physician interaction. In our interest in thinking about how our work might not just enable us to learn from our participants, but also enable healthcare professionals and our colleagues in medicine to learn from these narratives too, we've drawn on this idea of narrative medicine. Narrative medicine broadly refers to, I suppose, a clinical practice that is fortified by narrative competence. The capacity to recognize, absorb, metabolize, interpret, and ultimately be moved by stories of illness. An emotional responsiveness and form of human attunement based on close listening. It's about assembling and conveying what symptoms mean to patients, recognizing patients' particular perspectives on their symptoms, and thinking about patient agency. Key here is the idea of listening to patients, being curious, spending time thinking about their stories and priorities. Now, the use of patient stories and narratives is something that's quite common across multiple NHS trusts. There's a sense that listening to and learning from stories can help healthcare professionals understand the patient experience and then improve healthcare delivery. Some trusts have even begun to develop whole toolkits on using stories to improve patient carer and staff experiences and outcomes. And obviously there's a large kind of overlap and perhaps grey area between a specific narrative and story-based approach and qualitative research in general. But why is this important for our work then, thinking about ethical preparedness in genomic medicine? Well, Katie Featherstone and her colleagues make the argument that really a sound appreciation of everyday social reality is of profound importance for professional genetics practice. It's vital for researchers and practitioners alike to ground their work in an understanding of everyday family practices that is sensitive to their complexities. And I think this applies to genomics and a lot of really complex healthcare practices in general. So Bobby and I have a great interest in this idea of stories and narrative being quite central and important to healthcare. And really our work on the EpiGen project, Ethical Preparedness in Genomic Medicine project, stems from a belief that ensuring healthcare professionals are ethically prepared to deal with the rapid expansion and mainstreaming of genomic medicine within the NHS requires them to have this understanding of what it might mean to access genomic services from a patient and family perspective. So we've been working with a group of families with lived experience of rare genetic disease to explore different ways of creating representation, stories and conversations about the patient and family experience of genomic medicine. And I suppose our aim has really been to understand their hopes, expectations and worries, and provide an outlet for reflecting on what everyday life is like at a time when so much focuses on the promise of genomic medicine. Our research is interested in exploring how the affective and promissory discourses surrounding genomics are reshaping the social worlds and lived experiences, or perhaps are not reshaping those social worlds and lived experiences of those within the rare disease community who have been offered whole genome sequencing. And ultimately, similarly to disability studies scholar Kirsty Lydiard, our aims are really to enable our participants to situate their stories against and amongst the myriad stories already told about their lives by experts. So we worked with regional rare disease networks and support groups to recruit participants with lived experience of rare genetic disease in their families. Our participants were parents of children with different and sometimes undiagnosed conditions, resulting in complex physical and cognitive impacts, facing the challenges of navigating often oblique pathways to accessing clinical and social care support. And this group has shaped our research throughout, guiding our development of questions, methods, and dissemination approaches. So we began initially by working with a creative writing tutor, and we organised a series of workshops. And each session involved different creative writing exercises that were designed to enable both novice and experienced writers to begin to build confidence in expressing lived experience. The aim was really to enable people to convey how they, as patients, families, carers, live their everyday lives outside of healthcare settings. Writing for some topics and some participants created the opportunity to respond carefully and thoughtfully. Participants could spend as long as they needed to complete their written reflections, considering carefully their responses in an atmosphere less structured and pressurized than perhaps an interview. More creative, more playful. Writing creates a very different modality of representation. Now, the pieces of writing that were produced are powerful, they're evocative, they're revealing, but they don't necessarily provide answers or solutions, but instead their value lies in helping to unfold the implications of experiences and really illuminating what is often submerged or eclipsed by wider socio-technical or clinical frames. Now, we have a lot of stories from this phase of our work, but they don't tend to lend themselves very well to being read out during a time-limited presentation, particularly one before lunch. There's a short extract from one on the slide, and if I have time at the end, I'll come back to this and read it out properly as well. I mean, that's just a few paragraphs. It goes on for quite a while, but it's a very good one, so I'll try and make time for that. We've also been utilising collage as a form of qualitative inquiry. Collage is a modality of artistic expression which involves repurposing and juxtaposing fragments and offers space for different modes of representation and ultimately different knowledge to emerge. On the screen is a collage produced by one of our participants who explained it's supposed to kind of chart in a very simplified way my feelings of guilt from my son's birth to death, which is not to say there weren't a lot of other feelings along the way, but I think guilt is a common one among mothers, and particularly mothers of disabled children, and I wanted to acknowledge that. The collage segments and juxtaposes lived experience and medicalized encounters in different quadrants of a graph. Clinical encounters can frequently leave little room for appreciating lived experience and the types of emotions and aspects of life that this collage draws attention to. Hope, family, play, school, holidays. It's perhaps telling that many of the more medicalized images are the ones assigned to the guilt quadrants. This is another collage, and it takes up the challenge of really presenting an account of the intersections between motherhood and the everyday experience of life with rare disease. By playfully and critically incorporating the vocabularies often applied to mothers, the collage highlights the gendered pejoratives that can creep into and shape the caregiving experience. Mollycoddling, tiger mother, overprotective. These labels, literally printed out with a label maker, contrast with the participants' inner feelings, which are instead picked out in needlework. Talking about her inspiration for putting this artistic commentary together, our participant reflected on her struggles to be taken seriously as simultaneously both a mother and a caregiver in a healthcare context. She explains, I asked for her notes, but of course, even by doing that, it puts you up there as so we've got all the notes, and it says, Mother struggles with the idea of acceptance around her child being undiagnosed. And mother was emotional when spoken to. And phrases like, Mother is on support group. Somehow you just don't have any validity. I've had to ask my partner to come as well, because at least then it's not just the hysterical mother. We've also experimented with animation, where again, working with a local artist and facilitator, we designed a series of workshops to take participants through the process of producing their own stop motion animation film. I like to say this is a bit like Wallace and Gromit, but our participants get very annoyed at me saying that because they worry the standard is very different, but I'm not so sure. The filmmaking workshops often spark conversations, recollections, and stories of both similarity and solidarity amongst group members. There was something about the process of smoothing and sculpting plasticine in turn that smoothed the way for uncomfortable conversations. And many participants reflected that their stories emerge through the practice of doing and making, particularly conversations about bodily vulnerability as our clay figures frequently fell apart. And to our delight, this work appealed to participants who had previously opted out of research based around more textual creative practices, really highlighting the appeal of visual research methods and their ability to draw in different voices, people who might not normally contribute to research that is perhaps based on more oral or textual traditions. Now, few of the animations produced through our workshops focused on genomics itself. No one animated a next generation sequencer. Not that I'd know what one looked like if someone did. No one animated strings of DNA. But instead, animation offered us an insight into, I suppose, the wider social context that remains outside of this exciting technological development, and the everyday realities of families that are caught up amidst this genomic excitement. So many hopes are placed on genomics, yet the films reveal that often this is only the start of an even lengthier clinical journey, and there's need for careful communication around the prospects of genomics as a panacea or the end of a journey. We've also taken idea from the idea of mail art, building on our writing work and inviting people to use postcards as a canvas to anonymously send in thoughts and reflections more frequently and over a longer period of time, as and when they felt they had something they wanted to share. This asynchronous method has been particularly effective in creating a space for people to respond to things happening in their lives, things both mundane and significant, and often prompted by visiting certain places, medical or otherwise. This one reads, "Have we been forgotten?" Just over 8 years ago, a study subject was born. 8 years ago, I begged to be put on the studies. All the studies. We wanted another child. They took blood. The professor was positive. "Wait 6 months," he said. 7 years ago, we heard nothing. 6 years ago, we had another child. We heard nothing. 5 years ago, we heard nothing. 4 years ago, we heard of others who had heard something. We heard nothing. 3 years ago, we heard nothing. 2 years ago, we heard nothing. 1 year ago, the study subject died. 1 year ago, our beautiful, brave, gifted, loving boy gained his angel wings and flew away. Heard nothing. Have we been forgotten? Does anybody care? We have a huge archive of these, and we've been really surprised how powerful these sort of thin uh, paper rectangles are. And we've recently published a piece sort of analysing them to explore how families affected by rare disease navigate inaccessibility and exclusion, how rare disease shapes domestic spaces, and the importance of and challenges associated with family-based identities and communities in the context of rare disease. Now, some of these themes may seem familiar to disability scholars, but our research has really sought to showcase how the specific rare disease context, where there is sparse societal knowledge and understanding, often compounded many of these feelings of marginalisation, complicating matters of accessing adequate health and social care support. For example, services for rare disease, by their very nature, are often sparse and specialised, requiring extensive and expensive travel, and thus often encouraging a reliance on the transformation of the home into an epicentre of care. As the postcard on the screen queries, how can I afford to run the feeding pump, the airflow mattress, charge the hoists, afford the 80-mile round trip to the children's hospital, and keep us all fed and warm? We recently developed an exhibition of these postcards at the recent Festival of Genomics in London, which is the UK's largest annual life science event. So really amazing to have an invitation to sort of exhibit social science and ethics and arts-based research at a sort of festival where people are talking about very technical things that I don't understand. And the postcards received great engagement throughout the event, and we actually invited attendees to write their own postcards back in response to the displayed postcards. And again, we had a really positive response from people writing quite powerful and personal responses to these, and being quite moved from learning about the challenges that remain in improving the quality of life for families affected by genetic conditions. I think people are often in that sort of scientific technical bubble, very excited by technological progress. And then having opportunity to sort of learn about all the sort of seemingly simple challenges and social challenges that remain. Finally, we've supported our participants to co-edit a collection of poetry called Helix of Love. Over a series of workshops, again facilitated by an arts practitioner and poet, our participants really developed a poetic voice for exploring the varying ways that rare disease shapes their lives. Week by week, each session introduced participants to different techniques for creatively expressing lived experience. Participants then collated the poems together, working to choose which stories and experiences to include. And that involved choosing some that didn't make it into this final collection, that remained as something they had written for themselves or to share with their communities. The poems in the collection really position human stories and identities alongside the sometimes dispassionate prose of clinical communication. They really remind readers that rare disease patients have phenotypes beyond their medicalized characteristics and relationships stronger than those designated by the genealogy. What's been really inspiring about this work is the way that it's been received by the medical community, who have been really open about how useful these kinds of affective and emotive outputs are. We knew that there was an appetite for this kind of work. Indeed, some medical journals, surprisingly, even the Journal of the American Medical Association, even have sections inviting the submission of poems and poetry commentaries relating to the medical experience. So we knew that there was an interest in poetry, but really the uptake and engagement we've had has been really exceptional. And Helix has received critical acclaim from stakeholders across the genomic sector. It's become part of library and museum collections, and was even incorporated into the NHS-led International Genomics Education and Training Summit, where it was distributed as a training resource to delegates from 49 countries. And since then, we've received requests from genomics programs around the world to use Helix as a way of embedding a focus on patient and family experiences of rare disease. And we know that, that the books have traveled really well. I'd like to try and play a short clip of one of our participants reading one of their poems now. Hopefully it will work and you'll have sound. If not, there are subtitles.
First of these is called 38 Weeks. Ultrasound number 1, a routine scan. Measuring a little small, nothing to worry about. Come back again this afternoon. Ultrasound number 2, senior radiologist, fetal medicine. Body small, head smaller, brain underdeveloped. Some anomalies, some concerns. Come back again at 5 o'clock. The MRI is underground. The day staff are clocking off. The consultant arrives, shedding helmet and high-vis. The radiologist stays late. No, of course, no problem. The neurologist is called. We all shake hands. I lie inside the belly of the machine, thin cotton against cold metal, earrings out, feelings in. Click, whir, click, whir, buzz, click, whir, clunk. Get dressed and wait over there. Holding hands on plastic chairs. A wall of medics files through the curtain. I'm grateful for their time. I wish they weren't here. Microcephaly, listen carefully, simplified gyral pattern, polymicrogyria, cortex, corpus callosum, ventricles, white matter, grey matter. Won't walk, won't talk, won't feed, might breathe, probably won't survive. The neurologist tugs at his tie. The radiologist picks up her helmet. The consultant looks me in the eyes. Are you committed to this pregnancy? We can sign the forms right now. And the first of these is called...
I think this hopefully really demonstrates the power that the poems can have in conveying emotion and lived experience in a very rich way. That in this instance in particular demonstrates how something like the routinization of screening can lead to certain assumptions being built into care and certain valuations of life. And I think that's what's been really powerful about Helix in particular. There's something quite pedagogically interesting. As I said at the start, our work was interested in whether accounts of patient experience might contribute to the preparedness of clinicians to deal with the ethical challenges of genomics. And I mentioned we've been really successful in having some of our creative outputs incorporated into training materials. And this really highlights how the mediums through which stories are told are important in affecting what stories are told, but also what stories are heard. Many of the themes that have been centered through our creative research aren't perhaps groundbreakingly new, say, in terms of the impact of language choice in clinical communications. It's a theme discussed at length in medical sociology scholarship. But what we found is that by giving these creative outputs to clinicians in the form of a book of poetry, many have come to the realization and discovery of these ideas and themes themselves. And I think that that's a very different pathway to learning, particularly when combined with the emotional resonance that something like poetry can have.
First of these.
Some of our participants have gone on to have their poetry published in other places too. This is another piece by Alex entitled Proband, which, as she describes, the poem really began life as a response to a paper on the genomic diagnosis of rare pediatric diseases in the New England Journal of Medicine. The paper describes positive advances towards understanding of genetic disease based on a study of 13,500 families touched by developmental differences, using exome sequencing and microarray analyses to investigate the genetic causes of disease, and achieving a diagnosis in a remarkable 41% of patients. However, Alex was struck by the impersonal language used, proband instead of person, phenotype instead of features, which seemed to distance the paper from the real people and experiences about which it is written, and from the impacts of the work upon their lives. She says, I wrote this poem in an attempt to re-establish a link between genomic science and its subjects, using details from the life of one such patient, my son. What's been incredible and has really given me a lasting commitment to this way of working is as I've said, the way that really that this work's been received by stakeholders, clinicians, policymakers, scientists. I've been doing social research for a while now, but never have I had this kind of reception to my work before. I'm used to having to make the case for why social research might be valuable to feature, knocking on doors to try and find a way in. And this work has been quite the opposite. We've had invitations, it's traveled around the world, we've presented at big science festivals. And for me, it's really showed what is possible through creative methods, the appetite that exists, and how much further social research can travel through artistic forms. Co-production and empowerment are at the heart of our research, and we'd like to think we've been really successful in enabling our participants to directly inform and guide our research. Some of the choices around working creatively and artistically have really come from them. The choice to work poetically in particular was at the request of our participants rather than a top-down researcher-driven choice. What's been fantastic is the sense of ownership that people have developed too. People have used their artistic creations in their own spheres of advocacy. And as I've just said, they've gone on to write further themselves, even getting their work published in other places beyond our project. And that's been really meaningful for us to sort of, in terms of thinking about participatory research and not wanting to be extractive, but actually give people something, leave people with a skill that they can continue to use, either as a form of self-reflection or as a form of advocacy. And people have told us that having time to explore these topics has been really empowering, and it's encouraged them to advocate, to share their stories and build communities and find a new way, a new and different voice. And I hope, as the quote explains, that we've demonstrated that there are people who want to listen and that sharing stories can have an impact. Our creative approach has allowed us a great deal of success with our dissemination and engagement programme, which has fulfilled our promise to our participants to make their voices heard. and particularly make their voices heard in a field, an area that is incredibly technical and complex. As I said, to have our work featured at the Festival of Genomics amongst people giving talk about the latest sequencing technologies and different omics was really important in ensuring that we showcase the value of the social sciences in allowing us to retain a focus on the human experiences that are at the centre of technological achievements in medicine. I mentioned earlier this idea of how our work has travelled and enabled people to read and engage and be moved by these themes and ideas that might instead be squirreled away in sociological or bioethics journals. To have clinicians read our poetry collection and come back and say, wow, this has made me realise I need to think more carefully about the language we use is really exciting. So I suppose to conclude, what is at stake and what can be revealed by co-producing new and different stories about rare disease? This is not about saying that creative methods provide a unique insight that would never be revealed through more conventional methods, but rather just appreciating the opportunity to produce different knowledge and to produce knowledge differently. The mediums through which stories are told are important in affecting what stories are told, highlighting the generative potential of arts-based methods to create space for different stories to emerge. In our work, these methods have enabled our research to engage and centre different kinds of narratives, different kinds of emotions and affects, providing different modalities of knowledge representation, production, and dissemination. We found that arts-based methods can create a space where people feel comfortable to explore different narratives, centre different identities, and challenge assumptions about life with rare conditions at a time when so much often focuses on the promise of genomic medicine. Our whole approach to the EpiGen project was really transformed by this creative approach. The use of creative methodologies with parents of children with rare conditions enabled participants to evoke rather than having to explain their emotions, showing rather than telling. It allowed for a degree of safety through permitting an ambiguity of expression. And it helped make visible to professionals the everyday aspects of people's lives that can be of far more importance than what happens in the clinic. The use of novel approaches, such as the opportunity to send postcards to us as researchers at any point, encourage participants to identify issues of importance to them at convenient times, on their own terms, and with minimal burden, even enjoyment. One of our participants remarked, "Well, it's just more fun if you post things," which is an interesting commentary on some of my past research. The conversations that took place between participants during the creative workshops and in response to each other's creations as well were as rich a source of insight as the final creative outputs themselves. And again, in terms of communicating these outcomes, being able to share these stories further and further, I honestly don't think we'd have had this platform if we'd stuck to interviews. No one, sadly, wants to display your transcripts at a science festival. And I should say, all of this was underpinned by more conventional methods as well. We did interviews, we did focus groups, and we used the sort of creative artifacts produced as kind of elicitory devices to sort of understand what people had made and why they'd made it. But alongside our methodological innovation, which has not been about being innovative for innovation's sake, but really thinking carefully about how to empower and engage overlooked and sometimes socially limited research participants. Our key findings around the impact of language choice in clinical communication, the efforts that people make to balance family life against medicalisation, how parental labour in managing rare disease is often dismissed, and the role of community advocacy in shaping rare disease engagements with clinical services. All the more, I suppose, detailed thematic analysis I've not had time to go into today has substantially added to the literature and really demonstrated that alongside exciting scientific and clinical work, rare diseases require sensitive understanding of the influence of social and cultural factors on the experiences of affected families. The stories, poems, films, and pieces of art our participants produced shine a light on many facets of everyday life and clinical care. They highlight, often with humour and emotion, the importance of language and interpersonal relationships, and evoke the personhood of the people whose genomes are at the centre of cutting-edge science. They make visible those who are too often forgotten or rendered passive. They remind us of the labour parents undertake as carers for their children and the persistence of seemingly simple, yet everyday barriers to accessing quality care and societal understanding. As the quote explains, I think people see you swan-like, gliding along, having these silly ideas about how easy you're making it look. They don't see any of all the bits that are going on behind it. Writing about nappies and children being resuscitated and all of that kind of thing. I suppose I feel it allows me to tell people what it's really like. With researchers increasingly challenged to think more creatively about how they might engage different publics and stakeholders in their work beyond the written form, our creative methods have also provided us with powerful resources for research communication and education. We know that paying attention to narratives can support healthcare professionals to understand additional dimensions of their patients. And we know that stories have lives, that stories travel, that stories remain memorable. And we hope that the creative outputs produced by our participants might prompt greater understanding of the lived experiences of families affected by rare disease. Thank you. And I realise I've sped through lots of the wonderful creative pieces produced by our participants. It's certainly one of the challenges of doing this more creative work, transforming it into a presentation. So if you'd like to read, watch, view with more time, then there are various links on the screen that you're more than welcome to follow up with. Thank you.
Well, thank you, Rich. That was fantastic and a really rich presentation. Did you have any of the creative writing that you wanted to share with us after?
It's up to you. I'm sort of conscious of time. I can either I can certainly send links, or I can read out now. But I don't know if people would rather sort of have a discussion, questions.
Yeah,
So
well, should we send the pieces around after?
great,
If you send me the
yeah,
links, that'd be
great.
great.
We can link during the
Um,
recording.
yes, definitely. Has anyone got any questions? You can put them in the chat, or you can raise your hand and turn your mic off, turn your mic on and ask them. But maybe I can ask one to kind of just kick us off. So, Rich, what do you think from all your, because you said at the beginning you maybe didn't know how to use creative methods and you were a bit new to it yourself. What kind of advice would you give to anybody on the call who's looking to use some of these methods but doesn't really know where to start?
Yeah. So again, with my sort of geography background, I knew that there was this really rich tradition of creative arts-based research, but not having an artistic bone in my body myself, it was something I never thought I'd engage with. And uh, having sort of participated in many of these things as we went, I confirm that I still don't have an artistic bone in my body. So one of the things that I think has been a real privilege of our methodology, and thanks to the sort of support of the Wellcome Trust, has been to engage arts-based practitioners in facilitating a lot of this work. So for each of the creative activities we've done, we've had people who as arts practitioners involved to really facilitate that. And I think that's been really important in enabling us to do it properly, to do it really richly, but also it added a lot of legitimacy to our work and for our participants as well. There was a sense that they weren't just messing around with us; they were doing something that was part of an artistic tradition. In collage, we actually did a sort of 2 sessions on the history of collage as a sort of women's art making practice. So people sort of felt that they were connecting to that tradition, and that work really picked up on a lot of these emphases around motherhood, which was really interesting. And again, as I said, I think you're empowering people to sort of, we wanted to give people a sort of skill that they could take away. And again, the poetry, to see so many of our participants that are still kind of writing in that way and felt that they've sort of learned something from being part of our research. That was really empowering. So I think I suppose advice would really be to engage with arts practitioners. I mean, obviously we're based in Brighton, so we have lots of colleagues locally that we can draw on. But I think that's been really important for our work.
Great, thanks, Rich. Yeah, I'll pass over to Rachel, who I think's got a question.
I want to start with a thanks, and this is probably quite a personal thanks, but I'm a lived experience researcher with a rare disease. My elder brother has a rare disease, My world is creative methods because I come from an arts background coming into health, so it felt very real to me and very lived. So I want to thank you as well for the way in which you've shared and represented the project. Even though I haven't been involved, it feels like it speaks to me a great deal. Something I'm really interested in is kind of a bit of the hearing more about the ethical dimension, perhaps as part of those creative interventions and workshops. And if there was any specific moments of celebration through those ethics or challenges or barriers that you could speak to, just because I'm always interested in those experiences from research projects as well.
Well, thank you. It's very kind and really again validating for us to know that you know, that this work does resonate and the approach. Yeah, I mean the ethics question is really important, and so we're based in the ethics team at Brighton Sussex Medical School, and so it's something we take very seriously. So I suppose the first part of this story is our ethics governance committee were very anxious and nervous about this kind of work. And I always joke that they're very comfortable with sticking needles in people for clinical trials, but getting people to write some poetry, woof, that's a step too far. And yeah, I'm being trite. I know there are reasons when you ask someone to write something, you don't necessarily know what they're going to write, and they don't know themselves. And part of the power of these methods is that journey of self-discovery. But obviously, we're touching on and engaging in the context of some often quite traumatic experiences and stories. So we did a very modular approach to ethics all along. It wasn't just sort of once and done, sign the consent form, thank you, see you later. When people would sort of write something, we'd check you. Would you like to share this with us? You don't have to. Would you like to share this with the other participants in the group? Again, you don't have to. Would you like to share it wider as part of our research? So there was lots of levels. And again, sometimes people kept things for themselves. Sometimes people said, oh, I'd like you and Bobby to see this, Rich, but I'm not comfortable with the rest of the group seeing it. And what was really interesting was this kind of shared culture of care emerged. And obviously, and I should have probably said this earlier on in my presentation here, that there's a sort of content note, we touched on issues of bereavement at times, sadly. But for many people in the group, that was a really tough topic, in the context of life-limiting conditions. Some people didn't want to sort of talk about bereavement. So people in the group became very aware, and there was this and it was lovely for us to see this kind of caring practice that emerged amongst the people we were working with, and that says so much about our participants as well. But I hope our approach to ethics from the outset sort of encouraged that and gave people that sort of sense of trust and confidence in us. So again, and even once people have said, I'm happy to share this, to the point that I think our participants get very exhausted by emails from me saying, okay, but now we've had an invite from someone else who'd like you to use this at this science festival, this public engagement event. Are you happy with it being used in that context? Helix of Love is a really interesting book in that if you look at the contents page, some of the poems have names attributed to them and some of them don't. And again, people really explored this on a kind of very modular individual level. So some poems they'd be happy to claim, others they wanted that anonymity. And again, I think giving people that choice and just space to sort of process things how they want. I mean, I suppose it's just part of that kind of approach to creative methods itself, and our desire not to be extractive. And it was one of the things the ethics committee worried about. They said, well, but if you're saying people don't have to share, what happens if you don't get anything? And I guess that was a risk we were willing to take. And actually, people have found it very cathartic to share, and to share with like-minded people within their communities, but also to, as that quote I used in the slide said, to know that their words are being heard. I think that we're often overprotective about people sharing emotive stories, and actually there can be something really powerful in sharing it if you know it is going to be heard. So thank you. That's a really wonderful question.
Can I ask a quick follow-on?
Go on.
Like, I know we've got minutes. Have you had to consider retrospective ethics within that? So the idea that people in the future might want to withdraw any aspect of their contributions and what that might look like as well?
Yeah, so obviously, we've said that once something is published, that really, that makes things a lot more difficult. So we encourage people to sort of think really specifically about that. But in terms of sort of our continued use of material, every time you went, so for example, the postcards, I think we've got nearly 100 of them. Every time we're going to use, I say, okay, this is the event, this is the context. I know you said yes to all of yours being used last time, but are there any you'd like to take out this time? So yeah, that's been interesting, and I think again it's one of those areas where the sort of realities of academia and publishing kind of makes things a little more awkward than we'd like it to be.
Great, thanks, Rich, and thanks, Rachel, for your question. We're coming towards the end because I don't want it to run over and then people go into other meetings or lunch that they've got planned. So thank you so much, Rich, for joining us today. This has been recorded, so will also be on the SBR YouTube, so you can watch it back. And we'll also include, when we send out the link to the YouTube, we'll be able to include all the links that Rich referred to, because I'm sure you'll want to explore all the fantastic resources and things from the project that he has shared with us. So next week we've got Dr. Sarah Bell from the University of Exeter speaking broadly on creative approaches to public health, but with a real focus on mobile methods and creative writing. So that will really kind of extend what Rich has said today, what Rich has talked to us about today, with the creative writing and like more kind of geographical approaches to public health. So that will be a really nice complement to today's one. And as ever, that one will be recorded as well, so you would be able to watch back on demand. But thanks again so much, Rich, for joining us today. It's been a real pleasure to hear about the fantastic work that you've been up to on the Welcome Project.